And it is now my honor to give the floor to Torosyan Arsen, the Minister of Health of Armenia.
Excellencies, distinguished delegates, I thank the President of the General Assembly for convening this high-level meeting for the first time devoted to the universal health coverage. This is a good opportunity to reflect on what we have achieved in the past decades and discuss further way forward in the implementing global effort to build a healthier world at the community, national, regional, and global levels. We appreciate that this year's meeting has also focused on the link between the universal health coverage and Agenda 2030. Indeed, health and sustainable development are strongly interlinked. The SDG 3 entails the need to commit to achieve universal health coverage by 2030 for healthy lives and well-being for all. Armenia reaffirms its strong commitments made through the previous political declarations, including on ending AIDS and TB and on the prevention and control of NCDs, the validation of elimination of mother-to-child transmission of HIV, continuous decrease of TB morbidity and mortality, strengthening the tobacco control and implementation of the FCTC requirements are among pledges that Armenia succeeded to realize. Armenia will continue to improve the access to primary and preventive healthcare services with a focus on poor and vulnerable populations and regions that have received less attention in the past. Strengthening of primary and preventive healthcare services, extension of basic benefits package for the poor and vulnerable, tackling NCDs and financial protection are amongst the high priorities for us. And the primary care system in Armenia is a good example of UHC, which is accessible for the whole population free of any charge. There has been an unprecedented growth of the health budget this year. Increase of resources enabled expanded coverage of health services for the almost 25% of population of our country, which gives an opportunity to increase financial protection and access to quality health services. More resources made it possible to define clear priorities, sharply decrease the burden of catastrophic costs for families, for oncological services, heart diseases, and stroke. Government of Armenia is strongly committed to enhance human capital and equity, focusing on improving service delivery by introducing comprehensive health insurance system. As equity is a cornerstone to our key reforms, we are now working to design on a model for effective governance of a single-payer mechanism and strategic risk pooling and service purchasing in health sector, ultimately aiming at improving financial protection. Health insurance reforms are needed to increase their share of prepaid revenues and better pool the risks related to financing healthcare so as to reduce out-of-pocket payments and improve healthcare access. I would like to outline the importance of cooperation across borders as key prerequisite for the promotion of UHC. The participatory and transparent cooperation platforms and multi-stakeholder partnerships are crucial for all of us, and we are convinced that by utilizing international evidence and constructive dialogues, we will manage to move together and build a healthier world where no one is left behind. That's why Armenia backs political declaration on UHC adopted by UN member states. I thank you for your attention.